Hello everyone and welcome to Pediatric Cardiology. If you're watching this video, it's probably because you're in my clinic and you're about to write a note about one of the patients that we saw together. So let's go over what I would like to see in a note for every patient in pediatric cardiology. Let's start from scratch. This video is meant for anyone from, an early medical student through residency. First off, you have the chief complaint. The chief complaint is a single word. It usually would be chest pain, palpitations, or it could be a combination of things, including patient came in with chest pain with palpitations. It's usually not a full sentence. It's usually just a quick little, this is the symptom that needs to be evaluated. The next thing is the HPI. In the HPI, the history of present illness, we're talking about the description of the main problem that the patient is coming to you for. So they might have an extensive past medical history, but they might be coming to you for a specific problem. So in this case, it might be chest pain. So I want to know the onset, when the pain started. Does anything make the pain better or worse? Is it a sharp pain? Is it a dull pain? Does it move anywhere? On a scale of 1 to 10, how severe is the pain? And is it kind of a on and off pain, or is it a pain that's constantly there? And the mnemonic that I was using that some may recognize is the OPQRST. I got that from the first aid. I don't know if they still use that, but so after you get finished writing the story of what happened to the patient in the history of present illness, I then want you to move on to the past medical history. You should focus on two particular things in my clinic, and that is the birth history, as well as if they have any significant cardiac surgical history. And then, of course, I want you to include anything else that's pertinent to the patient, whether they have asthma, whether they have any other endocrine, rheumatologic conditions. I want you also to list that under the past medical history. Next up, medications. Medications will be listed one at a time. You'll put the dose as well as how they take it and the frequency with which they take it. So for example, be like Tylenol, 120 milligrams every 6 hours as needed for pain. For allergies, if there's no allergies, I just put no known drug allergies. Otherwise, you can list the allergies that they tell you. Try to distinguish an allergy from an intolerance, and we can go over that in more detail another time. Next, you have the family history. For the family history, I want to know, is there any family history of sudden cardiac death in infancy or adolescence? Is there any family history of hypertension, diabetes, stroke, a heart attack under the age of 55 in males, under the age of 65 in females? Did anyone have any arrhythmia in the family that required an ICD or a pacemaker? Next up, we have the social history. Here, I want you to write down who the patient generally is. What grade are they in? What sports do they play? What are their hobbies? What's their favorite book? What do they like to do for fun? Just who they are. Who do they live with at home? Are their siblings healthy? Next up, the vitals. The vitals are auto-populated by our MAs, so you don't need to worry about that. And then I want you to list the physical exam. I want you to put a general section saying, okay, are they in distress? So I usually put general, no acute distress. HEENT, I usually put normal cephalic, atraumatic to describe their head. Also anterior fontanelle open and flat if they're a baby. You can also put sclera anecteric and moist mucous membranes. For pulmonology, I put clear to auscultation bilaterally, no wheezes / rails / rhonchi. For cardiology, I'll put regular rate and rhythm, a normal S1 / S2, no murmurs, rubs, or gallops, 2+ pulses in the radial and femoral pulses. You can also put dorsalis pedis in case you felt the dorsalis pedis instead of the femoral pulse. For gastroenterology, you want to put soft, non-tender, non-distended, no hepatomegaly. If you listen to the bowel sounds, put normal bowel sounds. For skin, put warm and well perfused, no rashes. Neurology, you can say no focal deficits. And of course, if you've done more than this sort of basic exam for the other systems, you can also include that as well. For the EKG, I want you to put in what you see on the EKG. Is it a normal sinus rhythm? At what rate? And then, is there any evidence of hypertrophy, ST changes, or T-wave inversions? For the echocardiogram, you can just copy and paste what I will write for the echocardiogram. And finally, your assessment and plan are probably the two most important parts of the note. The assessment tells me what you're taking away. It's your assessment of all the data gathering that you've accumulated to date and what you think this patient has. So you might want to have a summary sentence that'll say, this is a 15-year-old male with a history of chest pain with a clinical picture indicative of costochondritis. And then you're going to go on to explain why you think it's costochondritis based on the history and physical, this is costochondritis because the pain is reproducible on exam, and then go on to show further details of why that patient's history and physical is more indicative of costochondritis. And then you're going to talk about why other things are less likely. Pain does not occur during exercise, and there's no syncope associated with this chest pain. It's less likely to be cardiac related. You can also talk about how you don't think that it's hypertrophic obstructive cardiomyopathy because of the echocardiogram. And then your plan is going to be a bullet point response. Details of the plan should make sense based on your description in the assessment above.